This may sound unbelievable, but we know that by the year 2010, in the developed world, depression will be the #1 cause of disability.
The world just seemed dark and sad.
In my case, there was anger, there was frustration, there was quite a bit of fear, and it all resulted in a form of paralysis.
It truly is an illness, and one that we have to educate the public as an illness, and the payers and the practitioners to see it, treat it, recognize it as an illness.
When depression isn't seen as an illness, it can ruin lives, and it can even take lives.
It involves changes in our ability to think, concentrate, remember. It involves changes in the way we feel about ourselves, our lives, our future. And indeed, when depression is severe enough, we sometimes think that life is not worth living.
I found myself very lethargic. I found myself having a very difficult time getting up and out of bed in the morning. I also found myself pulling back from my friends and from my family.
Powerful words, and a powerful reminder that depression is more than just sadness. It is crippling, disabling, and it can be life-threatening. I know because I've been there. For many years, I suffered with depression, battling its darkness in private, afraid, as most people are, that my condition would be discovered and seen not as an illness, but as a personal weakness. Thankfully, I've come to understand that depression is a real biological illness and nothing to be ashamed of. In fact, 19 million Americans live with depression, so I am hardly alone. The good news is depression can be treated and prevented if we take the right action. No one chooses to have this illness, but as a nation, we can choose to provide better care for those who do suffer from it. We can improve access to care for people and families affected by depression. We can improve the quality of depression treatment. And we can improve the availability of peer support that can be life-saving. This program will explore the experiences of depression from the perspectives of those who live with it and those who treat it and research it. Although these are people from all walks of life, they have each experienced depression's devastating symptoms, and they understand the sense of shame and isolation that often accompanies mental illness.
People with depression are far too often seen as weak. They're seen as having some sort of flaw, and that could not be farther from the truth, because people with depression have backbones of steel.
The picture that others had of me at that time was still a hard-charging, dynamic leader who was doing his absolute best to be a superb leader of the Los Angeles Times and of CNN. There was no knowledge of what I was going through generally around the workplace.
I knew how to pretend to be okay. And people would tell me later, but I never knew you were feeling so poorly. You seemed fine.
Accepting depression was difficult for me because I thought I was too smart. Smart people don't let their emotions take over.
This impacts so many people other than the individual. So when you're talking about making policy, you're not just making policy for the millions of people affected with mental illness, but for all the people in the lives around them.
Depression not only affects personal lives, it affects our society as a whole. The economic costs of depression in the U.S. are in the billions. That is not just in treatment and medication, but in lost productivity and in its impact on our communities, on homelessness, crime, education. The greatest toll, however, may be the social stigma that can be almost as debilitating as the disease itself.
There's more than just economic costs. There's personal costs. There's people who are disengaged from society, parents who can't deal with their children, children who are disenfranchised from their schools and their work. So there's a huge disease burden that just has a rippling effect in our society.
We often talk not just about the absenteeism that's associated with depression, but we've coined a new term. We call it presenteeism. Businesses are paying for these individuals to be present but not functioning.
I was a bad employee because I was depressed, but I was afraid to tell anybody that because of the stigma that was attached to it.
We have to accept and recognize that mental health is part of overall public health. We have to destigmatize the problem. So being proactive through early recognition, prevention programs, and programs that build resilience and capacitance into society to prevent depression from occurring or mitigating the depression are where we should be as a society.